we should focus a lot on awareness. And because communication for me in life, if you can communicate well, almost every problem is solved. Food is almost like the medicine. In those days, they say food is the medicine. Before Western medicine came into play, before any of these Ayurveda came into play, any of those things, go back to the root. How would they have solved these problems? Just by eating. 10 kilos goes out as carbon dioxide from the body. You are losing weight, you are breathing out fat. So technology is the answer for solving the problem. It will definitely have, the side effects will definitely be there. And it is only through technology we are going to reach a lot of people. And the only thing we need to be mindful of is technology need not be only electronic. It could also be other technologies.
Okay, thanks a lot, Vijay, for joining us and giving us your valuable time. I would like to first start with the question that you've extensively worked in the health field now as one of the co-founders of Obesity Innovation Lab. You've worked on ground in India, Mexico, and with World Economic Forum. What is the biggest challenge you see vis-a-vis health in the coming decade for the world and for these countries as well?
That's a big question to answer, but maybe I'll give it a try. So there are several stages. Like when you look at the healthcare funnel, it has like four broad strokes. There may be many nuances to it, but there are four broad strokes. One is the awareness. Take issue like obesity. How do you make more people become aware of the actual disease, obesity as a problem? How do you make, like, they know that physically you can see some difference, but how do you actually make them aware of all the things associated with obesity? That's the number one piece. Second piece is diagnosis. How do you make more people diagnose their condition? Because not many people know that they're overweight.
Right.
So diagnosis, like putting a weighing machine in your house and checking, that is also diagnosis. Like 2 years back, I was weighing 100 kilos. And I will look like this, maybe slightly a little more muscles, and you'll feel like nobody will guess overweight with me because I'm quite tall. But then one day I realized, okay, I'm so heavy. And in the last 1 year, I shed a lot of weight to kind of get to that. So the second important bit is diagnosis. And the third is acceptance. Many people diagnose their condition, but they will never accept the need for treatment. So like even I diagnosed and say, okay, 100, it's okay. It's not bad. It be manageable, all that stuff. Like, how do you actually make people accept the need for treatment? That's the third piece. And the last bit is therapy.
Right.
And then there are barriers at each of these stages. For therapy, it could be around financial barriers. It could be availability of good doctors or good therapists for you to give guidance. So at each of those stages, there are different interventions, and all those are challenging ones. But from my experience, we should focus a lot on awareness. And because communication for me in life, if you can communicate well, almost every problem is solved. Communication is the most important skill in the world, according to me. Because I'm a big fan of the human body and I study a lot about the human body and all, and organs communicate to each other. Hemoglobin, carbon dioxide and oxygen need to communicate with each other so that oxygen can be detached from hemoglobin, get delivered to this. There is communication happening at all levels. Awareness, the problem is most of the time, especially in healthcare awareness, it's highly regulated because you cannot do marketing just like how you do for product marketing. Oh, you eat this, you will lose cholesterol, those kind of things. And all. When we were kids, there was a gingerly oil in India called Idayam gingerly oil. When it came, so it will help you reduce cholesterol. It's like, and then people used to remove groundnut oil and use a lot of gingerly oil. And they put a lot of oil thinking that it will reduce cholesterol. So effectively, you have not communicated well. So how do you make people aware of conditions? And I'll give an example for that. So for when we were working on a healthcare project in India, we were trying to make how might we enable low-income patients access expensive cardiac therapies. So this is a project that me and my co-founder, we worked in India. And when we were thinking about the healthcare awareness, primarily related to cardiovascular and rhythm issues, think of any heart problem. And so, what are the conditions for heart attack, if I may ask you? And you will say, based on
pain,
how
on, pain on the left hand side, maybe breathlessness.
breathlessness, pain, and then some people say, oh, excessive sweating,
Yes.
uneasiness in the chest area, pain in the shoulder and all. Now, pain in the shoulder could come because I lifted weight this morning doing shoulder exercises. Breathlessness come because I ran. Excessive sweating because it was very hot outside. I was walking a lot. Breathlessness for some reason. None of this is very clear for the audience to relate to, because this is not the unique identifying factor for that disease. It is just one of, it could be, maybe, might be, that kind of a thing. So where I got a breakthrough insight was, as we were doing the project, we started in Durgapur and then we moved to Chennai. And there was this hospital in Chennai, Madras Medical Mission, where we were working. And I was working with Dr. Ullas, who is one of the senior cardiologists there. It's a very friendly, nice gentleman. He said, Vijay, like, you're doing this project, you should meet my pacemaker patients. I have a community. And these guys meet once in a year. And why don't you come for that event? So I went to the event. There were like around 100, 150 pacemaker patients. And I started talking to them, like, what was the time when you realized you needed this therapy, and what led you to take that therapy? And almost all of them, like 3-4 people I spoke to, had very similar things. One guy said, I was watching TV and suddenly from my stomach there was a spiral wave kind of a thing. It came and hit my heart and I was thrown out of the sofa. I was sleeping and there was a pain in the shoulder, and from there was a swirling kind of motion. It came and hit the chest, thrown out of the bed. And so, and almost all of them were talking, the common denominator in all of them is like there was a spiral movement, and that comes and hits the heart, and you are thrown out. Not like normally, like you are shaken or you are thrown out. Now, this, if I communicate, there is a higher chance for people to kind of take action immediately than saying, oh, if you have uneasiness, chest congestion, shoulder pain in the back, excessive sweating, none of this communicate really well. But the problem even in this one is like there is nobody who has diagnosed everything perfectly to say that this is the only way cardiac problem can be diagnosed. But the question then is, can we actually then communicate at least with these kind of examples that will make people get a hook that they can relate to, and when issue strikes, they can come and respond to that. So to answer your question, I went through a long, winding example. So it's those 4 pillars: awareness, diagnosis, acceptance, therapy. Each one of them have barriers. According to me, in the healthcare space, I think the awareness bit is very low, especially in countries like India and all these emerging countries. And if we can communicate and articulate really well, taking these stories and symptoms with foolproof, easy to digest ways to understanding, then we have a better chance of bringing more people into the funnel of healthcare.
Actually, you've raised one very important point. For example, in a country like India, or maybe we have examples from other places also, where, for example, obesity would not be even considered an illness, right? I talk to somebody in India or somebody of my parents' age, and they'll say, no, you're fit, you're from a good family, that's why you're healthy, you're not obese. Is there a step being taken by different governments and organizations in order to ensure that we, one, accept that there's something which is impacting you?
Yeah, no, it's a great point, great question. And also there is this, like, just to add on to your question, there is this notion that in India, when we are growing up, when you go to a guest house, they'll feed you to eat more.
Yes.
Fill your stomach, and you should have no room in your stomach, and you should keep feeding, and that's our way of taking care of guests. Nothing wrong with that. But the eating full is also a concept associated, like, you should eat better, you should eat a lot, you should eat full, you're a young boy, you should eat more. All this communication actually sends something into the thing. I have noticed in Japan, I studied in Japan. So in Japan, they have tackled this problem very effectively. Before I come into that, there are 2-3 countries where you can actually experience, like US has the highest incidence of obesity in the world, among the large countries. And all the Pacific island countries, Tuvalu, Fiji, You name all the small island countries. Small island states have the highest incidence of obesity anywhere in the world. And nobody could associate, because you would expect people to walk a lot, swim a lot, eat natural food, but somehow there is this notion we need to investigate more. So it is in large countries like US, India, Mexico. Obesity is a big problem. Small countries, Qatar has one of the highest incidence of developed country. It has the highest incidence of obesity. Tuvalu, Fiji, and all those small island states, they have also. So it's across large countries and small countries, it's spread. Across developed and developing countries, it's spread. So it is an important thing that needs to be addressed. In Mexico, when you go, I've spent a lot of time in Mexico. 7 out of 10 people that you see in the road, visually you can actually feel they are overweight. And it has got a lot to do with the food. So there is, and US, you can also see in US like how it's become like a very, very common thingy. Japan, you don't see that many. In Switzerland, you don't see that many. I live in Switzerland. You don't see that many. And I'll give that example of Japan, how they tackle. Japan, in the school, the cooking is for all the students are given food only in the schools. They cannot bring lunch boxes to schools. And in the schools, they have actually, the government has mandated them to prepare fresh food with all the nutrition, everything that's required, to prepare them in the way it is want. And then every school has a nutritionist in the school. And there's constant training to the kids on the importance of nutrition and hygiene. So you are preparing the kids from a very young age on the importance of nutrition, the importance of eating fresh food, the importance of eating balanced food, and all those things. And then it kind of is taken as they grow into adulthood, the habit kind of continues. So you don't find that many obese people in that society, and that's how they have tackled it really well. So it's a combination of government interventions. In our countries, some of these other countries, religion used to play a very important role, because you can actually spread these messages effectively through religion which kind of penetrates into your food habits, into your everyday rituals, all that. But somehow a country that is known for being religious, being known for worshipping water. When we go to Rishikesh and Varanasi, the Ganga Aarti, you are worshipping nature. Today is one of the most polluted countries in the world. So the input food, the obesity, like what are the inputs? You are inputting food, water, and air. And air is polluted. And that input is contaminated. Water is polluted. That input is contaminated. And now your food systems are broken, and you're eating all the processed junk food, because the families are becoming double income families. There is not much time for the parents to spend time with the kids, prepare food, keep it in the fridge, or instantly order something through these apps, get those foods, eat late at night, no discipline around that. A lot of these factors are now contributing. So a country that's known for malnutrition suddenly is now known for obesity. On one side, we can say, we are developing. On the other side, this is one of the biggest side effects that's happening. So to answer your question, like development definitely contributes in a negative way through these kind of manifestations. But there are countries like Japan which have been able to hold their culture strongly, even with modernity. And then that also manifests in the form of good practices inculcated from a very early stage of life, which allows them to tackle this in a much holistic way.
Right. So I would like to come back to Obesity Innovation Lab. It's a unique idea that way. Can you just explain what is the idea behind Obesity Innovation Lab? How do you plan to work around obesity, and what are the steps that you all are going to take vis-a-vis design thinking and nudges to be precise?
Yeah, so we innovation labs. So companies set up innovation labs, and we have helped set up a lot of innovation labs when companies primarily tackling the future of work in the consumer industries, in the healthcare industries, and all that stuff. But my time in Mexico, then in my own family, my son actually was overweight. After COVID, he got he's put on a lot of weight, and we were struggling to kind of reduce the weight, because there are certain food habits that got set in. It was hard to unwind. So I was actually thinking, okay, this is on one side, I am personally invested in my son and I need to do something about it. And I'm going to Mexico. The more people that I'm meeting, they all have this. And I came across this obesity research institute in the Tec de Monterrey in Mexico. And I was thinking about it a lot. Like, why can't we apply our innovation principles to this problem? Because this is not a problem that can be solved with just medicines. This requires, if you remember the healthcare funnel that I was talking about, awareness, diagnosis, acceptance, interventions, it's all these steps. And as you rightly pointed out, there is a lot of behavioral issues that need to be tackled. So it's a systemic issue. So there are, like, what we're seeing is overweight is like the tip of the iceberg. And then under the iceberg, what are some of the patterns? What are some of the trends? What are some of the underlying structures that we need to kind of work on? And then most importantly, what are some of the mental models that we need to change? And the more I thought about it, I think there was an opportunity for us to apply systems thinking on innovation principles like design thinking and these methodologies, nudging behavioral science, and most importantly, entrepreneurship. Like that is what we do, like systems thinking, entrepreneurship, and human-centered design. That's the intersection that we operate. And if you inject behavioral science into that, there's an opportunity to kind of make a difference into this topic area. So we hosted a roundtable with some key decision makers from nonprofits, business, government, and civil society. And we actually all felt the same. Hey, there has to be something that needs to be done, but what is being done is not enough. We need to take it much more deeper. And this makes sense. So that was the origin of how this lab came into play. And then what we do here is, as I said, we will go and discover into the community. Let's say India, US, and Mexico. These are our primary target geographies. And then like take a stakeholder target audience group. For now, like one example I can give is like the Fernandez Hospital in Hyderabad, that we have a memorandum of understanding with them. They work with pregnant ladies who are obese. Now, this is a target audience. Now, with this target audience, what are some of the challenges and pain points that they deal with? And how can we then apply our human-centered design principles to tackle them in a systematic way? And an example I can give is like when some of these obese mothers, when they're pregnant, the stomach hangs up to the knee. Now, how do you do the C-section? Do you do it on the top or do you do it on the bottom? Because it's not easy for these mothers to kind of give a natural birth. And if you have to do it on the bottom, which is the natural thing, you need to really pull the whole stomach out. And there are reflector, they have a term, I forgot that. They have to pull it. Now, that's a great opportunity to do some kind of a low-cost disruptive innovation because it's very expensive and these mothers cannot afford that level of therapy. So can you think of low-cost solutions that can then help these mothers also achieve C-section in a way that a person in the developed country can achieve? Just an example I'm giving. So that's one bit of it. Second is, how do we actually help young people? Chennai, I read a study that like 4 out of 10 students were found obese in a study of 1,200 students in Chennai. Now, how do you make these students become aware of the importance of nutrition? And you can educate them, but what will entice them to kind of adopt it into their lifestyle? And you need to bring their mothers inside, and the mother is working, the father is working. So you have to increase the maid into the scheme of things. How do you cook nutritious and tasty food and not just tasty food? So there are different layers that are in there. And as a lab, what we are now trying to do is like, can we then identify those unique frustrations and pain points? And then how do we come up with these how might we questions that can then stimulate ideation? And once you come up with ideas, these ideas may not be the perfect ones, but the idea is to go out and test in the field. So how do we quick test, learn and iterate, and through those iterations, rapid continuous iterations, you can get to a potential solution quickly. And that's what this lab is all about.
So correct me if I'm wrong. What you're focusing on is that not only one relies on medicines or say expensive therapies to correct these issues, but also adopt a behavior change and impact their day-to-day life.
Exactly. And there are medications, like weight loss medications. People go and say they take weight loss medications. Now they need to understand the science behind weight loss medication. So when you did, so what does those medications do? I don't want to name any, but people are all aware of it. Like those medications, what they do is they were created for diabetes.
Right.
This is one of the positive side effects, which is weight loss. And what it happens is it reduces your desire internally, desire for hunger, desire for. So it doesn't stop the desire for eating. It stops desire itself. And so some of the side effects of just taking medication without understanding that would be you will lose desire for sex. You will lose desire for physical activities. You lose desire for many things, and that will make you an ideal person.
And that can also impact your mental health.
Absolutely. So it is not just about taking medication and solving that problem. And it is not just about doing exercise, because you can do a lot of exercise, but your weight will not reduce because food is the main. Food is almost like the medicine. In those days, they say food is the medicine. Before Western medicine came into play, before any of these Ayurveda came into play, any of those things, go back to the root. How would they have solved these problems? Just by eating. And so, in a sense, like being active, being mobile, being aware, and the awareness, I keep repeating that because it is a mental thing. Raising the awareness is like you are actually moving above and raising the awareness, and then through meditation, mindfulness, and a lot of breathing exercise. And breathing, this is one important thing that I'm learning in this. I'm spending a lot of time these days on breathing, reading about breathing. And breathing has a direct link to metabolism. And breathing leads, like if you have ineffective breathing, it leads to overeating.
Right.
And if I ask you, do you know when you lose weight, what happens to the excessive fat? And you say, let's say you are 84 and in 6 months you become 74. What happens to the excessive fat? 10 kilos.
No idea.
So people think, oh, it'll go through the stool.
Yes.
But actually what happens is 84%, 10 kilos, 8.4 kilos becomes carbon dioxide. 1.6 kilos becomes water. And the 1.6 kilos of water, it gets excreted through sweat, urine, and through the stools. And the rest, 84%, you are breathing out as carbon dioxide. So 10 kilos goes out as carbon dioxide from the body. You are losing weight, you are breathing out fat. So we need to really understand breathing also, which is a very important thing. And that is something that I've been pushing a lot. Like, how do we bring in breathing, conscious breathing into the scheme of things when it comes to obesity treatment? Yeah, so it's very layered.
No, Vijay, I mean, it's also contradictory in a way. We are moving in a world which is very growing technologically, right? And with technology, what we associate is we are sitting in front of a TV, we are holding mobile, we are staying indoors, we're not going out. So, but then people are also saying that technology will have, you've talked about awareness. How do we aware people? We need to use technology to make aware people. So what links can be drawn between technology and all these steps to make sure that we live a healthier life?
That's a great question. I may use a slightly different word instead of saying contradictory, which is true. I would use the word paradoxically. So paradox is like totally absurd and contradictory that in fact may be true. So it's the same word, but I'm just correcting that. See, the way to resolve a paradox in life is only through awareness. The moment you are aware, the paradox resolves itself. Now, your question is, how do I raise the awareness through technology? Because technology is the thing. See, like my kids use phones all the time. And I see them like watching YouTube, scrolling and all that stuff. On one side, I used to be scared. Like, oh, these kids are getting spoiled. All the time they're scrolling and this is the only thing they're doing. They're not studying. But like recently I was talking to my daughter. They both are now teenagers. I talking to daughter and she was saying, oh, I was reading about lucid dreaming. I was learning about lucid. And she was explaining about lucid dreaming in ways I have not understood it. And where did you learn? I was watching YouTube. Then I was thinking they were just sitting and wasting their time. Of course, they do waste their time also. But they're also learning a lot of interesting because this has become their main mode of doing anything in life. Like when we were kids, we were thinking about the TV as oh, this will spoil the kids and all that stuff. And so every generation will do something. So technology is inevitable and we cannot do anything about it. Technology, the way it can help is like one, so how can the awareness be raised is even your diagnosis can lead to awareness, increasing the awareness. I have routines every day morning. When I get up, I come and I have, like, just in front of me, I have a weighing machine. I come and measure my weight. I drink water. Measuring my weight, actually what I do, I use a technology to measure my weight. And it's not like the regular weighing machine. It can also weigh my muscle mass, fat composition, all that stuff. Now that leads to an awareness for me that, okay, I am actually today like 82.9, yesterday I was 83.1, tomorrow 84.5. I'm actually correcting. Like if I'm overeating, suddenly the awareness comes into that. So just a simple, I'm kind of giving a simple example. Then the question becomes, okay, one Vijay is able to kind of control his craving and doing that well. How do we then translate that to 1,000 Vijays or 10,000 Vijays?
Right.
So one way I am doing actually to solve that problem, like I have created now a community. So I have like 20 people in my community, and my goal is to get to 1,000 people. So we constantly feed people to become more physically active. I will send you also, if you're interested, you can also join that community. Now, I can already see today is the 95th day of the year that I have continuously done physical activities in it. And in the group, people have crossed, most of the people have crossed 60, 70 days in the year. So already for me, that's a big win. Right. Now that is 20 people. How do we do that at a mass scale? For me, technology is the answer. While technology, as you rightly said, technology is the one that causes the side effect. Technology is the one in the form of WhatsApp group is allowing me to bring this community together. Technology in the form of YouTube is allowing me to learn and share this knowledge. Technology in the form of even conscious breathing is a new technology I'm learning. Technology doesn't always have to be electronic technology, right? So there's a breathing technology that I'm learning, and I'm kind of applying that. So technology is the answer for solving the problem. It will definitely have the side effects will definitely be there. And it is only through technology we are going to reach a lot of people. And the only thing we need to be mindful of is technology need not be only electronic. It could also be other technologies.
Right. So my final concluding question, what would be your message to, say, a normal audience watching this video or a policymaker watching this video vis-a-vis these issues? Because one, as you rightly pointed out, realization is important, awareness is important, but it can't be done until unless a mass level intervention is happening, right?
Yeah. So for me, maybe I'll take one target audience. Like there is a mother, there is a policymaker, there is different people. So I will just take a policymaker as a target audience. Now, for policymakers, data clearly points out that 4 out of 10 kids in one city called Chennai is obese. And BBC, there was a study there saying 1 out of 10 obese patients in the world in 2030 will come from India. So, and we are a country of 1 billion people, and we have the youngest workforce in the world, and we are poised to take over the superpower tag in the next 20 to 30 years because we are the growth engine for the world. Now, if this growth engine has to be sustained and thriving, then this is one of the most important things that the country needs to tackle, because your workforce has to be productive, healthy, and it is only when they are productive and healthy, everything will fall in place. And if with obesity, what will happen? More people will stay mobile. There'll be more workforce degradations. There will be further healthcare complications because obesity will lead to a lot of other diseases, diabetes, cardiac. It increases the chance of every other disease. It will also break families with kids not able to get into adolescence in the right way, not getting married, being insecure about that, lowering the fertility rate. It's a cycle. It's a systemic problem. It's a cycle, and it'll create an endless bout of things. So with obesity as an anchor, if you address that, the country can produce healthy, productive, and empowered citizens, because more awareness also leads to more people thinking about the whole, not just being selfish about the part. And that will also be contributing a nation building. So policymakers take this as the most important issue to address, and support organizations like us, join hands with the Obesity Innovation Lab and communication experts like Pranjal, who are trying to take the healthcare communication seriously So let's all work together and tackle this condition.
And the most important thing, we'll also have happy citizens.
Absolutely. Absolutely. And that's the essence of a government, right? The role of a government is to ensure that its citizens lead happy, peaceful, and fulfilling lives. Happy, healthy, and fulfilling lives.
Right. Thanks a lot, Vijay, for giving us your time. Thank you so much.
Wonderful. Thank you, Pranjal. Pleasure talking to you.